Well, there's a lot of different research going on. Most of the other research are on sort of different pre-hospital stroke scales and sort of large vessel occlusion. Yeah. But I think, well, what we're trying to do is sort of bring the same scale that everyone uses in hospital out into the paramedics, which it's the most validated, most used sort of stroke scale around. So why not teach paramedics to use the best tool there is? Why settle for a scale that's been derived from the NIH stroke scale but isn't as good? And
has to be translated in the emergency room to NIH stroke scale score. So.
And also it's the fact that there's the majority of strokes aren't large vessel occlusion, so you need to identify and treat the smaller strokes as well, because they can be quite debilitating for the patients.